ulcer is the breakage of the tissue's integrity in one or several points of stomach. The ulcer may touch only the mucous cover or perforate the organ hole wall. The stomach juice properties change is determined by its acidity increase. It occurs because of increase of chloride content as a consequence of its creation and emission by so-called facing cells of the stomach mucous cover. The disease is usually stimulated by the nutrition regime breakage, dry food consumption not in determinate hours. It's impossible not to take into account hereditary subjection to the ulcer disease. Besides, there are bacteria having to do with the ulcer development, Campylobacter or Helicobacter. A range of clinical reflections, whitenesses about the appearance of sharpening or the ulcer disease. The main of these factors is pain. It's usually accompanied by dyspeptic disorders, nausea, vomiting and acid stomach content, heartburn. In case of cost treatment by DENS and scan apparatus, the blood microcirculation in stomach recovers, as a result of which the regenerative processes in mucous cover accelerate. The stomach ulcer pain fit. The epigastral zone is treated in continuous mode. Energetic level is comfortable or maximal. The treatment area is of human palm size. The apparatus can be transferred or slowly moved. On the pain area, the apparatus should stand 10 or 15 minutes till the pain elimination. After the pain elimination, the course treatment is carried out. The session begins from the front direct stomach projection. Further, the back direct stomach projection is treated. The operation is held in dose mode. In case of pain presence, the area is treated in continuous mode. The stomach area is treated every session. Other digestion organs in a session or each third session. The front direct liver projection is treated in individual dose mode. In presence of stones in gallbladder, the apparatus is put on the front liver surface. The pancreas front direct projection is treated in individual dose mode. The pancreas back direct projection is treated in individual dose mode. The liver back direct projection is treated in individual dose mode.
При заболеваниях печени,
In case of liver and gall outflow waste diseases, the patient is bothered by pain in right hypochondrium. The pain may be weaning, there may be feeling of heaviness, discomfort, and there may be sharp intensive feet pain. Besides, there may be nausea, vomiting, bitterness, dry feeling in mouth. In presence of these symptoms, the liver area, lower part area of chest on the right is treated. In this case, liver is treated from all the sides, from the front, side and back. The treatment is held till the statement of patient improvement, till decrease or elimination of the pain feeling. Chronic hepatitis is the disease of a virus, autoimmune or toxic nature that is characterized by the liver inflammation with necrosis and developing fibrosis. The patient may suffer from weakness, nausea, pain in the upper part of stomach, icteric, less frequently vascular starts, increase or decrease of the liver size, splenomegaly. On late stages, there may be portal hypertony signs noticed. In serum, the bilirubin content increase, transaminase and alkali phosphatase activity, but these indices can be in norm. In case of DENS therapy, influence on the direct liver projection and organism on the whole, the anti-inflammatory, holagogue, hepatoprotective and hepatoreparative effects. The liver ferments activity level decreases quicker in case of its initial increase, usually before the bilirubin level normalizing in blood. The liver front direct projection is treated in continuous mode on comfortable energetic level. The apparatus must be transferred after 5-7 minutes on point or moved by 1 cm per second, till the elimination of significant decrease of complaint. In presence of stones in the gallbladder, the apparatus is not put on the front surface of liver, in hypochondrium. The back direct projection of liver is treated in continuous mode on the comfortable energetic level.
При обострении хронического
In case of chronic pancreatitis sharpening or in case of the sharp pancreatitis, the patient is bothered by the pain in the upper parts of stomach, often irradiating into the back of belt or half-belt type. We call these pains belting ones. In presence of such a symptom, the treatment is carried out in the area of maximal pain, and the pain irradiation zones are treated too. So to speak, where there is pain, there should be the apparatus. Chronic pancreatitis. The factors causing the sharp pancreatitis may be the reason of chronic pancreatitis characterized by stable structural changes in gland tissue. In case of chronic pancreatitis, the pains in epigastriae are the most characteristic. They irradiate into back and forth alcohol and heavy fatty meal consumption. Sometimes the signs of pancreas ferments deficit are noticed. That leads to steatorrhea, nutrition insufficiency and slimming. The swelling and fibrosis of the pancreas head are revealed in obstruction of the pancreas pancreas, part of common gall canal, and sometimes in hepatitis. In case of DENS and scan influence on the direct projections of pancreas, the emission of pancreas juice and insulin by the organ normalizes. The pancreas front direct projection is treated in continuous mode on comfortable energetic level till the significant decrease of the complaint elimination. The pancreas back direct projection is treated in continuous mode on comfortable energetic level till the significant decrease or complaint elimination.
При заболеваниях кишечника,
In case of intestines, under the irritated intestines syndrome, under the non-specific ulcer colitis, under the Crohn disease and other intestines diseases, the operation is held taking into account of character of stool. The rules are as follows. In case of normal stool or under subjection to constipation, the operation is held on the direction of content in big intestine. The operation on intestines can be made in several ways. In presence of pain feeling, the liver zone is treated first. In this case, the apparatus is transferred or moved on the liver area in continuous mode and then moving the apparatus. The operation is held from right to left, upwards, from the liver to over pubic area. In absence of pain, it's possible to operate by gliding movements, rotary movements clockwise, by spiral from navel to the stomach periphery and then in the same direction continuing the rotation to the navel. The operation time is 20-25 minutes. In presence of implementation to stool leniency or under diarrhea syndrome, the operation is held in the opposite direction. In the pain presence in continuous mode, the apparatus is transferred from over pubic zone through the left hypochondrium to the right hypochondrium, and the operation finishes by the liver area treatment. In absence of pain, the apparatus is rotated spirally anti-clockwise from navel to the stomach periphery, and otherwise rotating the apparatus in the same direction. The ulcer colitis is the ulceral damage of the mucous cover of the big intestine beginning with the rectum. It's characterized by prolonged flowing and accompanied by heavy local and system complications. Multiple and overlapping ulcers of a big intestine mucous cover lead to unexpressed intoxication, emission of a big amount of mucus, blood and pus from the rectum, sharp breakage of exchanging processes and septicopia, damage of skin, eyes, joints, liver and so on. Because of the high penetratability of the ulcer, process damage intestine wall, and directly as a result of perforation of ulcer, the local limited or pured peritonitis. At the beginning, the liquid stool with the addition of mucus and blood appears, common weakness is noticed. The diarrhea can progress 20-30 times a day and lead to dehydration, exhaustion, sharp anemia, electrolyte exchange breakage with spasmodic syndrome, the peritoneum irritation, the stomach blister, sharp toxic dilatation of intestine. System damage can be noticed. In case of cross influence of DENS and scan apparatus, the microcirculation of blood in intestines improvement take place, as a result of which the regenerative processes in the mucous cover of ill organs accelerate. The intestine's front direct projection is treated in individual dose mode. From the navel, the zone spirally expands and ends on the front direct projection of sigmoid rectum. If the stool is normal or if the patient has constipation, the operation is held clockwise. If there is a diarrhea, anti-clockwise, from end parts of intestine to the navel spirally. In case of the disease sharpening, the operation is held in continuous mode. In case of remission, in dose mode. Further, the lumbar sacrum zone is treated from the first lumbar vertebra till the last sacrum one. The asymmetry zones are revealed in individual dose mode. If they are found, the apparatus is transferred to continuous mode and the operation is held for 2-3 minutes. The zone is treated on Su-Jok system of conformity to intestines on the hand and foot. The continuous mode, comfortable energetic level, 2 minutes.
При заболевании почек и
In case of kidney and ureter diseases, the patient is often bothered by the pain in the lumbar area that frequently irradiates into groin, into the lower part of stomach. In presence of such a symptom, the lumbar area is treated in continuous mode on the comfortable energetic level. The operation is held till the decrease or elimination of pain feeling, and then the ureter's projection is treated. In this motion in continuous mode, the apparatus is transferred downwards, from the back to the front to the other pubic area. The feat of urinary calculosis. In stone formation, a big part is played by the metabolism breakage, endocrine system disbalance, breakage of kidney, hemo and urodynamics and the inflammatory process in the kidney pelvis. The patient present the complaints of pain in lumbar, sometimes a kidney colic appear, hematuria, leukocyturia, outflow of fine stones with urine. The operation of DENS and scan apparatus leads to improvement of urine analysis. Kidney function and their morphological statement improves. In case of coarse treatment by the apparatus of the urinary calculosis, the stones in kidney begin to become friable gradually, diffuse and go out in the form of sand, even without pain fits. The operation is held on the lumbar sacrum area with the accent on the kidney direct projection, the continuous mode, comfortable or maximal energetic level. The operation time till the pain syndrome elimination. Further, the area of kidneys and ureters is treated. The apparatus electrodes are smoothly moved by skin in continuous mode on comfortable energetic level from both sides. The speed is 1 cm per second. Sugar diabetes is the disease connected with the breakage of carbohydrate exchange. In this case, the sugar level in blood increases. Sugar appears in urine. In case of sugar diabetes, as with any other disease, the operation should begin on the patient complaints. The patient is often bothered by the pain in extremities or diabetes angiopathy type. In presence of such symptoms, the feet are treated in the direction of soak putting off, in continuous mode from the ankle joint to the fingertips. By thigh and shin, the apparatus is moved downwards. Often the vascular or vis retina and diabetes retinopathy. In this case, the vision sharpness decreases. In presence of such complaints, the area of eyes is treated through the closed eyelid. The apparatus is put on the eye in continuous mode for 2-3 minutes on minimal energetic level. In case of sugar diabetes, the diabetes nephropathy develops. In this case, the patient often and heavy urinates. In presence of such symptoms, the kidney and ureter's projection is treated from both sides. Sugar diabetes without complication is a clinical syndrome determined by the absolute or specific insulin insufficiency. It is characterized by chronic hypoglycemia with the development of decompensation of all metabolism tears, both in sharp and chronic form. The known specific symptoms that can be met in any type of sugar diabetes are being thirsty, polyuria, polydipsy, skin pruritus. In case of course influenced by DENS and scanner apparatus, the partial or complete recovery of insulin-producing cells take place. In case of insulin-dependent sugar diabetes, it's possible to decrease the dose of medicines and in the range of cases to refuse from medicines at all. In case of any type of diabetes, very good results are noticed in curing of diabetes neuropathies and periphery blood circulation breakages. One of the pancreas direct projection is treated in dose mode on minimal energetic level. During the operation on the back direct projection of pancreas, the softer effect is noticed. Then the liver direct projection zone is treated. Continuous mode, minimal energetic level. The operation time not more than a half from the length of operation on the gland direct projection.
При заболеваниях женской половой
In case of female genital system diseases, the patient is often bothered by pain in the lower part of stomach that rather often irradiate into anus area into growing into genital organs. There can be the menstrual cycle breakage, alcohol feeling, sweating, fever feeling. In presence of such symptoms, the maximal pain place is treated. The overpubic area is treated. The area of the groin crease, perineum, the suture conformity zones can be treated. Lactation mastitis is a non-specific inflammation of dairy gland. It appears mostly in lactation period. The entrance gates of infection is the nipple and the round nipple field fractures. The milk stagnation is important for the mastitis development. The stimulant is golden staphylococcus in combination with other coccus flora and Escherichia colic. The lactation mastitis often appears on the first afterbirth month of the first pregnancy. On the background of milk emission, decrease the expressed pain in the gland, temperature rise, alga appear. The dairy gland is swelling, becomes painful, and in the range of cases, the skin hyperemia appears. The operation by DENS and scan apparati leads to increase of blood microcirculation in the dairy gland that encourages the fracture healing, inflammation elimination, and lactation stabilization. The direct projection of the inflammation source is treated. The continuous mode, comfortable energetic level. The operation is held till the pain decrease. Then the ill and sound dairy gland is treated in dose mode from the periphery to nipple. The whole gland is treated from all the sides from periphery to nipple. The electrode can be transferred or moved. The movement speed is 1 cm per second. In case of lactostase, the whole gland is treated for 10-15 minutes before feeding or decanting. The dairy gland segments are treated in individual dose mode from the spine to periphery. The segment width is equal to the width of a palm. After the light sound signal, the apparatus is transferred. The right and left sides are compared. In case of asymmetry, the apparatus is switched to continuous mode and the area is treated for 2-3 minutes. The ovary zone is treated. If there is no pathology, the operation is held in individual dose mode. If the asymmetry zones are revealed, the apparatus is switched to constant mode and the zone is treated. Fibromyoma is a benign tumor of the muscle tissue. The myoma development reasons are not investigated to the full. A certain role belongs to hyperestrogeny, encouraging the muscle fiber growth and hypertrophy. The main clinical expressions of myoma are as follows: uterine hemorrhage in case of undermucous ganglion position, the near organs squeezing symptoms, frequent urination, constipations, pains in case of blood-feeding breakage and necrotic changes in ganglions, reproductive function breakage, premature delivery, sterility, birth activity breakage. The operation of DENS and scan apparatus leads to positive results. The fibromyomas in case of initial uterine dimensions with the pregnancy term till 8-9 weeks, the apparatus operation initially leads to elimination of clinic expression and then to full regression of tumor. Fibromyoma in case of uterine initial dimensions with the pregnancy term more than 10-11 weeks, the apparatus influence improves the woman's statement, clinic expression disappear, the tumor dimensions decrease till 4-6 weeks. In case of female genitals diseases, if there is a process, the operation is held in continuous mode in the pain projection till 10 minutes. Then the zone from navel to pubic is treated. First, the central line is treated and then the treatment is made in fan form. The asymmetry zones are revealed in individual dose mode. If any are found, the apparatus is transferred to continuous mode and the zone is treated for 2-3 minutes. In case of gynecological diseases, the lumbar sacrum zone is treated. The zone is limited by the first lumbar vertebra and sacrum. The asymmetry zones are revealed. In case of such zone revelation, the apparatus is transferred to continuous mode and the operation is held for 2-3 minutes.